Healthcare is so far behind every other industry, from the financial industry, manufacturing. We're behind so many industries in terms of how we use data and information and how we use technology to help people to be healthy and to get rid of a lot of administrivia, a lot of error, a lot of repeated care that is costly to an already expensive system. We're a little bit behind in where we should be. Now that said, I don't apologize for that. You know, I used to have a phone that was attached to the wall and it worked just fine. There are some very nice clinicians out there who take really good care of people, take meticulous notes, and know how to use the existing referral systems to get things done. Think how much better we could be with the kinds of technologies that are in the marketplace now if we could really get them to use in healthcare. Some of the things that people don't like is when they're meeting with their doctor and their doctor is typing on a keyboard, but they're not looking at them. That bothers patients. They want the few minutes they have with their clinician to be eyeball to eyeball, pretty much. There's a question about how dependent do you want any clinician to be on some decision support tool set that comes through a computer screen rather than what they actually see when they examine you. There's a lot of experimentation going on between how much support does a clinician want and need as they take care of someone with, say, a chronic condition or just preventative health services versus get in the way of what is an important human interaction. So I think there's some questions about that. I think there's also questions, and even the FDA is questioning whether some of these devices that give you medical advice, all these websites, all these handheld smartphone applications, they're starting to wonder, do some of those things need to be regulated? Many EHRs are simply digitized pieces of paper, but many of them include decision support, and some of it is very good. So in other words, it will automatically say, this person's allergic to penicillin, therefore you don't want to prescribe this class of drug. That's a good thing. So the system is actually helping the clinician to be smarter. And that's just one piece. We're just talking about information technology as it touches the doctor and the patient. There's hospital-based technologies. There's all kinds of, if you've been in a modern operating room, have you seen some of the robotic surgeries? I mean, they're amazing. They're computer-driven, computer-assisted surgeries, which were impossible to do even 12, 15 years ago. So the technology is taking us to a new place, and we have decisions that we need to make on how we're going to use them. I'd say the last thing I say about technology that was actually pointed out to me by a colleague of mine is we also want to make sure technology doesn't leave people behind. Could potentially access to technology create more divide in people's ability to access healthcare, or could it be used to really lessen the divide between people who have easy access to care and those that do not? We have to be cognizant of the fact that we could potentially create more disparity rather than close the gap. So as long as we're aware of it, just like these other issues, it's a question of awareness on how we're using technology that I think will make the difference. And everyone I know is trying to do all the right things.